Today's talk is going to look at anatomical shape and position and looking at the terminology we use within anatomy. For example, when looking at shape, you can see many muscles that contribute to their name. Here you see the trapezius muscle that starts off from the occipital region of the skull, extends all the way down the cervical vertebrae to the thoracic vertebrae. And from the T12, what we classify as the end thoracic vertebrae, then goes onto the clavicle and extends back to the occipital region. Hence the name trapezius in shape, or trapezioid. So a lot of description can be found within anatomy. If we go to the next shape that we see within the muscles, we identify, for example, biceps. Biceps meaning two heads of the muscle. We also find it, for example, in triceps that we see a three-headed muscle, or quadriceps, four-headed muscle. Again, all they are descriptive parameters that we use for anatomy. So, identifying here on this slide, we can see the quadriceps. We see that it's four sections of muscle tissues, each predominantly with their own head of origin and insertion. Each of the muscles are predominantly different within shape, however they all have the same principal factor within the movement pattern. So if we're looking at size, and the best option to look at in descriptive terms within size is the gluteal muscles. Gluteal muscles that form the back side part of the human, that you'll find the gluteus maximus. And gluteus maximus is one of the largest muscles. So what we've got there is a descriptive parameter of the gluteal muscle tissue. We've got the gluteal maximus, meaning the largest of the gluteal muscles. Now if we look at the section of the gluteus maximus, we can see that it originates round by the femoral section, round to the iliac crest of the pelvis and further beyond. But if we look at the other type of muscle within the gluteals, we see that we've got gluteus medius that is often mistaken for the middle-sized muscle. Here you can see that it's part of the gluteal group. It's a medial muscle, smaller than the maximus, and also insertion and origin of the muscle group. You can see here that it forms just from the greater trochanter region of the femur up to the iliac crest of the pelvis. So we can see here now that we're getting descriptors within anatomy. So we go through a next stage that we can see, and we have gluteus minimus. Minimus, again, is a smaller group of the gluteal muscles. So we've got minimus as the smallest, maximus largest, medius in between. Each of them are part of the gluteal group. They do the same function within the movement pattern, but at different allocations within the human body. Here we can see clearly that the gluteus minimus is far lower or inferior to that of the gluteus medius, which is further up the iliac crest. It also has a different origin point that you'll see here, around the neck, towards the neck of the femur. And so what have we got so far? We've got descriptors within anatomy. We've got those that are allocated for shape and size. But also we have for items that are looking at its position. One classic one is the ligamentum patellae. That basically is a patella that connects the ligament patellae, connects with the patella. So we can also break down the descriptive words. So ligamentum, meaning a ligament or part, description of the bone that it's attached to, in this case the patella. If you look, for example, here on the MRI scan, this is an MRI scan section, you can see here clearly, you can see the ligamentum patellae that also fits performally on the tibia, and also you've got the patella here and the femoral bone tissue here. So most of the objects that we see in anatomy are very descriptive, and anatomy really is just a list of words and locations. So here, for example, is another position. It's a joint and it's called the inferior tibiofibular joint. So where is it allocated? Well, if we break it down, we look at inferior, which is the lower region of the joint, tibiofibular joint, meaning in between that of the tibia and the fibula. If it was superior tibiofibular joint, we could see that it was a superior section of the joint, which would be located up here, that we see the junction of here between the tibia and the fibula, and this would be classed as the superior tibiofibular joint. So, what else does it do? Well, the other things that anatomy does is very descriptive. And for example, extensor digitorum. So it gives the movement pattern, what it's going to do, for example, extension or flexion, and also the item that it's moving, for example, the digitorium, digits or fingers. So in this case, the extensor digitorum straightens the fingers. You can see here that you've got a muscle group tissue that we see extensor digiti minimi. So what does that do? Well, it extends the small finger. It's very much a descriptive mechanism. Exactly the same in the title, flexor digiti minimi. Ends the little finger. I'm in flexion. So very much these words are all descriptive. We've got other words that we've got to learn, and these are, for example, profundus. Profundus basically means deep. It means any of the deep sections of tissue, such as the flexor digitorum profundus. So if we break it down, we know that it's a flexor muscle that moves the digits, the fingers, and profundus meaning deep. So it's a deep section of muscle tissue. If we look at the other section, we call it superficialis. And superficialis is what we call closest to the skin. It's the shallow piece of muscle tissue, the one that we first see before getting into the profundus group. So for example, in this case, we've got a flexor digitorum superficialis, which means the closest to the skin group of muscles that helps with flexion of the digits. So, what other descriptive mechanisms we've got? We've got longus. Longus meaning a long muscle tissue. So, in this case, an adductor group, such as the adductor longus, we've got a long group of muscle tissue that helps with our adduction patterns that we'll describe later. Also, we have, for example, brevis. Brevis means short. Adductor brevis meaning the shorter group of muscle tissues within the adductor group. You've also got, for example, other groups of muscle tissue, such as we see called, for example, pectoralis major, the larger of the pectoralis group. We also see within anatomy pectoralis minor, the smaller of the pectoral group. However, all these words so far are just descriptive mechanisms and show either location, size, and shape.